And here with us to talk more about some of the changes or things to look for in this round of sign-ups for Covered California is Craig Gussin.
That's right. Craig is a health insurance broker.
Yes.
And that we're glad that you're here with us today. So is it a surprise to you that more people are not embracing Covered California? And will the tactics that Kristen Casado just mentioned make a difference and have people sign on?
I'm not surprised because I think one of the things I look at is everybody in America is supposed to have who drives supposed to, get car insurance, but yet only 75% of those people get it. So if you look at those statistics for years, you got to figure with the numbers, you're probably close to 25% of the people are buying health insurance because it's exactly what Kristen said. Oh, the gentleman she interviewed, I've never been sick, so why do I really need it? And then all of a sudden he gets sick and he's like, okay, now I need it. The problem is, in that situation, you have to buy health insurance only between November 1st and January 31st. So if it's June and that happens to you, there's no way to buy health insurance for another 6-7 months. Mm-hmm. So I think you're better off getting something. And if you're not making a lot of money, you can get a bronze plan, which doesn't cover a lot before the $6,000 deductible. But at least you're only spending maybe $25 or $50 a year for insurance if you're not making a lot of money and you have some coverage.
Mm-hmm. The system needs young people. Why aren't they signing up? What's the deal there?
Because, Alan, when you and I were young, we never thought we were ever going to get sick. We were invincible. And that's what you're seeing now. Why should I spend my hard-earned money on something I'm not going to use? And if I do, I might go to one of these free clinics or a minute clinic, and it might cost me a little money. I'm never going to use it. I don't need it. And that's why they don't.
Mm-hmm. That's the thought, the attitude. Yeah. So it is renewal time, yes. And it's very important that at this time that you check the policy to see exactly what's covered, right?
It is really important because, for example, if you're the bronze plan, which is the least expensive plan, that plan has changed. It went from a $60 copay to a $70 copay, and you only get 3 visits. The newest thing that's really been a big change is on our prescriptions, you have to pay 100% of it, up to $500 for each prescription every month. And that was never like that before. With some of the other plans, the Silver plan and the Gold plan, your x-rays, your lab work, some of your doctor visits have gone up in cost. So you need to definitely check and make sure that if your health hasn't changed, and maybe the plan you have is good for you. Also, what's your income? Because if your income went up, Sandra, maybe you got a pay raise, you're working overtime, and you're making more money. Mm-hmm. Well, your subsidy may not be as high, so you got to come up with more money out of your pocket. You need to be aware of that.
Mm-hmm. California has an estimated 4 million still uninsured. What about the penalties? How does the state go about finding those people and levying a penalty on them for not getting insurance?
Great question. Everybody knows what a W-2 is. Starting this year, we're going to get something called a 1095-A. That says the insurance company is going to send it to every person, including you guys, and that's going to say that you had health insurance in 2015. And you're going to have that sent in with your tax return. And that's going to tell the government that you had health insurance and you're not going to pay the fine. That's a good thing on one end because that's how they're going to track them. On the other end, if Sandra, for example, is making very little money and doesn't have to pay a tax return, doesn't have to file a tax return, well, she's not going to get caught. Mm-hmm. The penalty is 2.5% of income, or $695 per family member. Mm. So that's how they're going to catch you. And it's a little bit different. You're going to get this form that nobody ever heard of, but 5 years from now it would be a very common number, the 1095As. So that's how they're going to catch it. And people just have to understand that if you get sick or hurt, the hospitals are going to get paid one way or another. And, you can't just think, oh, I'm going to go in and they're going to cover me. Mm-hmm. You have to get insurance. You have the opportunity to do it. Mm-hmm. You can't come to me on February 3rd and say, I want insurance. It's too late.
Right. Yeah.
And that's what happened last year, a couple days after.
Yeah. Craig Gussin, always great to talk to you.
Thank
you for coming in
My
tonight.
pleasure.
All right.